Good morning, everyone. Thanks for coming in this early. I saw the little, the bird animation. It's very appropriate for an early morning presentation here. So anyway, welcome. And so today we're going to talk about healthcare automation. And so what I wanted to set the stage on a little bit is, when we talk about healthcare, usually it's about the health record system, the EHR. There's the analytics piece, so looking at historic data of patients and such. There's the patient-doctor, patient-nurse relationship and the recording of notes and such. There's the clinical trials. But one part that is not often talked about is actually the devices that connect patients to the health record, the telemetry coming off from your blood pressure cuff or your heart rate monitor or such, and also the lab side. So what I'm going to talk about today is really that physical world in a healthcare setting, whether it's labs or whether it's a hospital or clinic or doctor's office, and bringing that data into a health record, but also how can we make things more efficient, more automated, and actually more secure and saving lives by having real-time data quickly available for the doctors, nurses, the surgeons, and so forth. So in today's world, there's really 4 or 5 areas that we care about. So first is what we call bedside medical devices. So those are the things that you're in the hospital, you have a blood pressure cuff, you have your heart rate monitor, your oxygen monitor, potentially an infusion pump that's working right next to the patient. So these are things that are directly connected to the patient in a hospital setting. Then the second part is what we call lab automation devices, lab medical devices. So in a lab, the technician is taking a blood sample, they put it in the machine, it starts to doing all the different types of tests that they do. It generates the results, oftentimes prints out the results, and then that goes into the patient record. So there's medical devices for the bed, there's the lab, and then the third one is what's coming up more and more is wearables, right? And wearables are starting to be used both in hospitals, so the patient has a heart rate monitor connected to their shirt or their robe, and then they can walk around and the patient's monitored. Or we can track whether somebody is actually walking around as they should before they can go home and such. And then there's a huge market for wearables at home, both for people at home that want to sort of track their own health a little bit. There's things like Oura Ring, which I'm sure many of you are familiar with. But there's also lots of medical devices that are sent to the home with patients. So you go to the hospital, they say, oh, you have to wear a Holter monitor to track your heart rate and heartbeat for a period of time. So they send you home with that device. What typically happens is it records on the device, and then when you go back in and you deliver the Holter monitor, then they can look at the results. So that's kind of a common case of how it works today. And then a fourth big range of devices are really the scanners, right? An MRI scanner, a CT scanner, which are these huge machines that generate images or imagery. That gets sent to yet another system where radiologists read it, they generate a report and then send that over to the doctor or the surgeon. So we live in this world where we have these big different categories of devices. And I can tell you today, the screen that you see right here, that's a real setting, it's a real picture, right? Many devices have no connectivity. There's still many hospitals and doctors' places where when they measure your blood pressure, it's a handheld device, and then they write the results on a piece of paper. Right? Or there's a lab device, and the lab prints out the result, and then the technician takes that, goes to the computer, and types in the results into the health record. Or an infusion pump where they manually have to program it right there and hope that they don't make a mistake when they press confirm. Or the scanner, where the scanner has a system locally, and the radiologist is remote, but there's no fast connection to the radiologist, and they have to come in. So there's lots of these things today that make healthcare very inefficient, right? And so what we set out to do when we acquired Cerner was we have an existing product that came in called CareAware, and so we have a set of these devices that have been built over the last several years to start doing some of this automation. So we have some devices like the top left and the center left one that connect to infusion pumps and connect to vitals monitors automatically. And then when they get the signals like your heart rate, it automatically sends that to a chart in the health record system, and then the nurse or the doctor can say, add this particular record to your health record. Now, what's interesting is that all the devices we connect to, there's no standard. So we have serial devices, we have devices that have a serial port but don't actually use a serial protocol. They use the pins with a specific set of signals that we have to interpret. There's USB devices, Bluetooth devices, Ethernet devices, a whole range of things. What's coming in now, certainly with newer devices and lots of startups that are coming into the wearable space, is that they have great devices that are connected to the internet, but they send it to their cloud service. So you don't have direct access to what comes from the device. The provider has to connect to their cloud service with their application to get that data to then put in the health record. So while there's some progress of making things be better online and having more ability to get data, they're all separate systems. They're all these tiny little boxes with individual protocols, individual applications, so it can automate, but you still have to switch back and forth. And if you've tracked the Oracle Health roadmap a little bit, one of the things that we've been looking at really hard is what can we do to help the workflow of a nurse or doctor or surgeon in a given day. And so if you have 5 different applications that you switch in between, we try to make these workflows part of one system so that you don't have to log into different places, you don't have to go from one app to another app. It's all very consistent and feels natural as you work towards your day. The same with lab equipment. Lots of labs that I've talked to still use spreadsheets to track tests today. Yes, there are LIMS systems and there's automation, but again, a lot of this automation is for a particular vendor. You go with lab equipment from vendor X and they give you lab automation system for X. You go with CT scanners of vendor Y and they give you the app for CT scanner of vendor Y. So it's a very, very complex environment. So when we talk about how can we revolutionize healthcare in this setting, it's really about what can we do to bring that disparate world of devices together. And we're looking at 2 things, because there's 2 types of telemetry coming off devices. The first one is the most important one, right? And that is the actual data related to the patient. So you do a lab test for a blood test, and it'll tell you your white blood count and all that stuff. Or you get your heart rate monitored and such. So all these things that are patient-related, that's one set of data coming off of these machines. But in order to really make a difference, we also need to take a look at the other world. The other world is what firmware is this infusion pump running? How many times is this pump run? Where is it in my hospital setting? How much is left in this test cartridge in the lab? If I have a DNA sequencer and they have these special flow cells with, let's say it's called 2,000 pores of what you run a test in, well, a test might use up 600, but there's no display on that test cell. So if you want to know what's in it, you have to go put it back in the machine, run a test, and then say, oh, it has 600 left. How do we automate that part? So how do we automate the biotechnicians world and the IT world? Because that will help the hospitals, as an example, infusion pumps. You have 5. You know that only 3 are always used. Well, one of them is somewhere in a closet that nobody remembers where it is, and this is real, right? One of them is broken and nobody has had the time to look at it. It's really hard to figure this out today because there is no such system. Right? And one of the things that Larry Ellison mentioned yesterday in his keynote that I found, that sort of how we work as a company is we're trying to solve sort of the whole problem end to end. Right? And one of the advantages we have at Oracle is we have so many tools. Right? I'm talking the low-level cloud stuff, of course, our great database, but all the application suites on top as well. Right? We have Fusion applications, we have supply chain management in there. We have HCM for HR stuff. We have PLM, so we can track certifications for, let's say, for biotechnicians and so forth. So we have all these big systems that are really, really good at a particular task. So instead of writing yet another suite just for healthcare that only solves that problem and take a long time to implement, we are basically making all our stuff work with all these different systems. So when we are tracking a DNA sequencer test flow cell, we actually store that in supply chain management because it's an asset. When we use it, we update that asset to say, hey, there's this much left, and then the biotech will know, oh, I need to send this back, it needs to be recycled, it's no longer used, I need to order more stuff. So that's how we can start doing some of this automation. And so what we have done is we've built, this really should be the end slide. This is what we would like to see. One nice screen with everything on it in one view instead of many different applications on different screens, but I'll get back to that one. So what we've done is we built this whole ecosystem of components that we internally built on, but part of the talk also from a developer point of view is we make all of these pieces available to our partners and our customers as well. So everything we build is also available for our customers. Everything we build on to build our application stack is built on the same tools as we provide. It's a message we've had for many years with Fusion applications. For some of you might remember that we always say, we use the same tools to build our applications as what customers can use. We don't do something separate. It's all tested the same way and so forth. So this is everything I talk about here today, anyone can use to build their own company with their own suite of products, whether it's healthcare or something else. It's a standard stack, but I'm going to talk about it and what we're doing with this in terms of healthcare. So at the bottom part, we have an IoT service, which actually just went GA on OCI last week. So when you now log into Oracle Cloud, there's an Oracle Internet of Things platform service available, so you can build your own IoT instance that comes with all the pieces I will talk about. So all these devices are IoT. A fridge is an IoT device. You can have the temperature in a fridge. You can have an RFID reader in a fridge. You have all the medical equipment, the lab equipment. Everything is basically an IoT device, right? A person walking around with an RFID tag or with a measuring device is technically an IoT device that you're tracking, right? It's an object. That's how I see this in this world, at least. It's a lot more important, but in this context, it's really the same. So what have we done on the IoT side? Well, IoT in general in the past has been a sort of an ingest port for lots of telemetry and data that then basically just either gets used in a publish-subscribe model. So data comes in and it's published on what it's called topics, and then there's these different processes that listen on a topic of interest, and then they do something with it. But it tends to be real time. Something comes in, there's something done with that data. The other part of it is it just gets stuffed into files in object storage. So millions and millions of data points that come in, and it just gets stored somewhere in case they need to be used later for doing analytics or data mining for historical use cases. And when you look at doing AI, when you look at doing real-time analytics, you need data that goes into a database where you can make use of all that data with all the tools that we provide. AI doesn't necessarily work really well on just a pump that has data coming in and goes somewhere. It needs to see sort of a collection of all these things and make it easy to vectorize it and query it. So our IoT platform is actually completely built on the Oracle database. So we use Oracle AI, I guess it's called Oracle AI database now, right? Oracle AI, we use 23 AI, but it will be upgraded to 26 AI soon as part of the process. And so all the data that gets sent into our IoT service immediately goes into the database. You get pub/sub, we use the database, advanced queuing or transactional event queues. So anyone that's familiar with database code can connect directly to these topics from the database, or they can create external processes that listen to topics, same thing. So we provide a pub/sub system, but we also provide just a general ingest engine. So the data comes in and it goes directly into Oracle database tables. Now the advantage for that is you can use any standard database tool to get to your data. You can do analytics, you can start up Oracle Analytics Cloud, and you can just point to your IoT service database and do analytics on that same data. You don't have to do ETL. You don't have to go and figure out how to point analytics to object storage and figure out all the different formats and devices. It's all just in the database. In terms of control, what we do is we have what's very commonly used as a term in IoT is a digital twin model. And so we actually follow the Microsoft Azure DTDL standard. So we've implemented this standard digital twin definition language. And so you can create a model of what payload comes from a certain device. So you have a temperature measurement tool that just basically sends temperature and device ID. So you can create a model that says, this device, this is the payload that comes back. So that's one part. So you can define all these different devices in the database with the right model. Now, the advantage of that is that it allows us to then also look at data normalization and look at values that are off and should be rejected or not. So if a certain device suddenly sends a payload that does not match that definition because of a bug or some corruption, then we send that to the rejected queue, so you can look in your database table for that device and say, oh, here are stuff that came in that's wrong. So from a debugging point of view, or figuring out if a device is misbehaving, you can immediately see that. You don't have to write code for that. It kind of comes out of the box. Normalization can also be, you have one device that sends temperature in Celsius and one device that sends temperature in Fahrenheit. Well, you want to normalize that to say everything in Celsius or everything in Fahrenheit. So as the data comes in, you can define a model that, or an interpreter that basically takes that value from Fahrenheit, converts it to Celsius, and then puts that into the database. So that when you write these clients that listen on a topic for temperature, that you don't have to do all that conversion on the back end, it does it right on ingest. The advantage of that is that when you make changes, you do it in one place. You don't have to go and rewrite all your drivers and look at all the different devices out there. You can do it just in one place. It's all done on the ingest side. So you end up with a big database, and then you have all the AI tools, because we're at AI world, right? So it's in the database, and so with 23 AI or 26 AI, you can then go and say, hey, natural language for, give me data on this temperature sensor over the last 3 days. Or an infusion pump. I have 5 infusion pumps. Tell me about these. The result of that, with simply using this platform and data stored on this pump is this is pump number 1. It's used right now. This was the result. This is the firmware version. Then this is another pump. It's in this room. An LLM will actually come back with a summary that says, well, pumps 1 and 3 have been widely used. 2, every now and then, you might want to bring that one into circulation to have more efficiency, so that you don't have these 1 and 3 going into maintenance at the same time, and you have a lack of infusion pumps available. It will actually be able to get that data out of the database just like that today. Right? It's a very powerful system to collect data on real-time values. And that's the thing where the database really helps with creating an IoT platform. It's about what can you do with real-time data. Because healthcare is not necessarily, certainly not in an active setting. It's real-time data. It's not the history. It's about what's happening today. Right? One other example of this would be when you take blood samples or you go to a lab and you do tests, there's blood samples that are stored in fridges. There's also reagents that are stored in fridges. Reagents are used to run tests, and they're used for doing a blood test with a certain, for instance, doing a cholesterol test or something like that. Now, these reagents are very picky when it comes to temperature, just like vaccines. So if the temperature goes up to 50 degrees for an hour, well, they're no longer valid. Well, if you go to a lab today, there's all these fridges, right? And they're at the right temperature. But what if at 2 a.m. there was a short power failure and one fridge went down and the temperature shot up to 60 degrees for an hour, went back to normal. In the morning, the technicians come in. Well, they didn't know. So they do tests. 3 months later, there's a note to the patient that says, hey, the test we did back then was using a reagent that was not valid. You have to come back. Well, that could be a life or death situation in the wrong case, right? So what we're doing is We have temperature sensors in fridges. We have RFID readers in fridges. We get all the telemetry. So if a fridge goes down or the temperature goes up for an hour, one, we store the documents for the reagents in the Oracle database. So the LLM knows about the reagents and what their characteristics are. Two, we collect the temperature on a regular basis. So if a fridge goes above a certain threshold, then through the LLM, we can say, okay, which reagents are in that fridge and which ones of those are actually affected by this temperature shift. Lab technician comes in the morning, generates a report, fridge number 4, reagents 1 and 2, you probably want to throw them out. So none of that is really done today, but that's the system we are building and we have in some cases already implemented. That's going to really change, for one, how labs work, and it has a huge impact on the patient as well, not just on the lab technician side and the cost. It's just one example. Anyway, so that's all part of this IoT platform. Data comes in, we put it in the database, you get all the LLM tools, you can create an MCP server that was shown yesterday, I think, in Juan Loaiza's keynote, directly to the database. Since it's an Oracle database, we have Apex on top, so you can build your own application on the IoT platform. You don't have to go and ETL data from one database to another or from one place to another, so you get a complete ecosystem. REST APIs, you can build your own application using some React toolkit that you like. You don't have to use Apex. You can just make REST API calls to the data. All of that stuff in one little service. You push a button, and within about 5 minutes, all that is available to you as part of an IoT platform. So when you look at the other vendors out there that are doing IoT, they basically give you the first part. Here's a port to send data to, and you can subscribe to that, or we dump it in files in object storage. We do all these other pieces as well. And so by having built this, we now are building the next set on top, which is the healthcare platform itself. And then go forward. Okay. Yeah, there we go. So the second part is connecting the healthcare pieces, right? The IoT platform's generic. The second part is healthcare piece. So what we're doing is a number of things. First of all, since the world's changing from physical devices with just a local serial connection or a USB connection to cloud connections, we're building lots of these cloud connectivity adapters. So a cloud device, let's say Aura, I personally use it, so I'm pretty familiar with it, that just becomes a device we connect to because we have a piece of code, a driver that connects to the Aura cloud service, handles all the token and authentication correctly for me, pulls in the data and puts it in the database. So a virtual driver for a third-party cloud is just the same as a physical device that we can connect to. We make no difference or distinction between that. We use FHIR and HL7 as the protocols for third parties to connect to. We do standard REST APIs as well, but that's really in healthcare is the predominant format of APIs that are used. And we care about open standards, so we're implementing everything using the FHIR adapter. We have this huge driver library on top of the IoT database. So on the client side, when it's a device that doesn't connect to the internet, we have the drivers for that and a little IoT device that transforms that into a JSON payload that goes to our cloud. That client device, I think Larry Ellison talked about this yesterday as well in the keynote. He said low-cost medical devices. And so we are building an IoT device that is low power, that easily connects as a secure element for security and easily connects to our IoT service without doing any extra work. That can be used by us or by partners or customers alike to build their own equipment. And then, of course, we do all the monitoring, the device management, and then the back end to the EHR. So all of this stuff coming in that is patient-related needs to go into the health record for that patient. On top of all of this, we integrate with Oracle Fusion apps. And so I mentioned earlier the example of the flow cell for the DNA sequencer, but that's just one example, right? There's all these examples of equipment that needs to be certified or validated. There's a maintenance schedule for equipment in hospitals. There's the certification for the biotech folks and the nurses and everything that needs to be kept track of, and that all goes into the HCM module and PLM as well. So there's all these different components that we send data to directly, you can send directly to from the IoT service. So we just make REST API calls and create the modules that know how to talk to SCM, that know how to talk to HCM and so forth. On the front end, we support standard protocols for ingest, so we do HTTP, HTTPS requests, MQTT, and then of course HL7 or FHIR commands that can come in. And then we do a lot of work with ISVs to basically broaden an ISV ecosystem. And sorry, this comes back to the workflow I mentioned earlier, which is we want to provide a seamless flow for the nurses and the doctors. And so there's two parts that I think are interesting to talk about in this context. So one is, if you're a surgeon and you have let's use colonoscopy as an example. Might not be the nicest one to talk about, but it's a very good example. So when the surgeon's doing the procedure, they're using their instrument, but they would also need to know what's the heart rate of the patient and what's the blood pressure of the patient, and what's the anesthetic status of the patient, and so forth. And so today, those are all separate visual things that they have to look at. So they're looking at the screen doing their job, and then they have to look up and look maybe 90 degrees to the left to see what the blood pressure is, or try and find where the heart rate monitor is, because it's all separate things. And so by having all this stuff going into an IoT database and centralizing this data, we can create dashboards that bring all of this together in one screen. And the doctor can say, I'm interested in these 6 things along with the display I'm using for the instrument. So they don't have to go look elsewhere. It's all right there in their direct vision. Right? That saves time, and it's also a lot safer because they don't have to take their attention away. Now, when it's really complex surgeries, this becomes more and more important. But today, that doesn't really work yet because all these devices are independent. They don't talk to each other. So we're basically now providing an ecosystem where we are a proxy to say, tell us what data you want to see, and we will bring that into a single dashboard for you. And then the clients can decide on that. Right. So that's a big part of of what we're trying to do in that space. The other one that this helps solve is also something that came up yesterday, which is the ambulance. If you're unfortunate and you get picked up in an ambulance and you go on your way to the hospital, well, the hospital might not have a record for you because you've never been there, for one. But also, if let's say there's a heart issue and they're checking your heart rate and the heartbeat and such, typically it's written down, or the EMT is remembering what's going on in the ambulance ride to the hospital. Then you arrive, and then the EMT has to talk to the doctor and explain what has happened from when they picked the patient up to when they got into the hospital. So you're already wasting time by having that transfer of knowledge happening after you arrive before the doctor knows what's going on. And so by being able to connect the equipment in an ambulance online in real time to the hospital you're going to, the doctor or the nurse can see the patient coming in, what's going on. When you arrive, they can immediately transfer you to the right place for treatment without having to wait for that transfer of info from the nurse or the EMT, without forgetting something that happened that would have been vital to say, right? So it saves time and also saves likely a patient's life in the case of something that's incredibly urgent. It also helps with generating reports. So one of the things we've done on the healthcare side is patient-doctor transcription, generating a report based on that conversation. Well, the same thing we're now doing with the ambulance. When the EMT is talking to the patient or to the other EMT in the ambulance, that is being transcribed. The telemetry is being transcribed and collected. So typically when an ambulance arrives at the hospital, and the EMT then has to write a report, both for insurance purposes as well as just part of the procedures of what an ambulance has to do, an ambulance service. Well, we can automate that as well. We generate a transcript, we generate a summary, we pick the right data from, there was a heart attack on the way to the hospital, or whatever it was. We collect that data and generate a report so that the EMT just has to read it and say, okay, I agree with this summary, and then the report's generated. So it makes the ambulance service a lot more efficient. Right? So that's something that is part of this whole ecosystem of connecting devices, because an ambulance is a device. Another example of what we're doing in this space is courier services today that pick up blood samples, as an example. It turns out that 30% of the time, they have nothing to pick up. They have their route, they go that route every day. But there's no system that says there's something to pick up at this doctor's office or not, or this clinic. So they go there, they open the box, nothing, get in their vehicle, continue to the next one. So we've built what we call the Smart Specimen Vault, and that was shown yesterday as well, I think, in one of the pictures. And the Smart Specimen Vault has RFID readers built into a fridge. It's a cooling device, basically. And it's also internet connected. So it has an electronic lock for access control. The RFID reader can track which samples are in there, or if there is a sample in there, and connects to the courier service. We measure the temperature, so it comes back to, we know whether the status of the samples in that fridge are correct. We tell the courier service if there's something to pick up or not. So it saves them 30% of their day in round trips. So makes delivery faster, more efficient, and lower cost. So that's something else that fully works on this IoT platform, because it's really just an IoT device providing data. But in a healthcare setting, really makes a big difference. On the client side, as you can see here, there's this thing called wayfinding, signage, and so forth. So I mentioned RFID a lot earlier. And so RFID can be used for a number of reasons, right? One is tracking equipment, like the infusion pump or anything else. And a big part in hospital settings that's expensive is they don't really know what they have or don't have and where it is, so they order more. They stuff every room with things because if they need to find something, they know where it is. It really happens like that today everywhere. So if we can provide better tracking in a central system, then nurses, doctors, or personnel know where to go find it, and it's easier to say, okay, we need to buy more of this, that, or the other. So it'll make things, again, more efficient and more cost-effective. In terms of wayfinding and location services, badges with our RFID tags will allow us to know where somebody is. So a visitor comes in, they get their badge, and when they're walking through the hospital, we know where they are. So if somebody isn't supposed to be in a certain location, we can track that. Or it provides positive identification of someone that's supposed to be in a hospital or in a location, and the camera sees somebody that's not being tracked. So they might not be allowed to be there. So security might be notified to say, there's an individual in this room that is not carrying an ID. So we can go there. Or track patients, especially for elderly folks that might wander out. Where did they go? Well, with ID tags and with our RFID readers, we will know, oh, this person left the room, but they're not allowed to leave the room. So go and track them down. Digital signage is important to have in real time, because what tends to happen is the food for patients is decided and printed out typically in the night before. So at, I don't know, 8 p.m., there's a printout for the restaurant. They prepare the meals for the patients in the patient rooms for the next morning for breakfast. So a doctor says, I need to do a quick test tomorrow morning, and if that test's okay, you can go home. Shouldn't eat. Well, the printout might have already happened, and they might have forgotten to have the order of no food for this patient. So person comes in with a meal, they don't know, give it to the patient eats. oh shoot, we can't let you go home, we need to keep you another night. Well, that's both expensive and annoying, right? And so by having digital signage connected to the health record in real time, what we're now doing, and this is already in production, this is not future stuff, we actually show the state of the patient in the room saying, don't feed them, or do feed them, or don't do this or that or the other in real time. So even if the printout happened, in the morning when the nurse comes in, they see, oh, no food, I have a plate, let's not give the patient food. That's a big thing that's really hard to control today, and there's a huge expense on doing these things. And so, when we talk about making healthcare better and easier, it's not just a health record, but it's really providing an IT ecosystem that connects all these different pieces and brings the data to the nurses and the doctors in real time. And the only way to do that is to create such a central system, but very important to also then connect to the partners, right? We obviously are not building all the different applications and connecting to all the different devices directly. We have a huge partner ecosystem that we work with, so that it's not just one box that does it, we connect the dots, we connect the other boxes. I already talked about the connectivity engine as adapters. This is something I mentioned earlier. We're looking at a new version of our edge device, the thing that connects to medical equipment, but broadening it by adding other sensors as well, because if we have a device connected to something in a patient room, then putting in more and more sensors basically makes the device a lot more useful, right? Temperature sensor, CO2, all that stuff, bringing in a camera. The camera is used to monitor a patient in a bed. And why is that important? Well, patients that are in a bed for a long time, they need to be turned around so that they don't get bed sores, right? And so the camera can monitor whether a patient's in a certain position for a very long period of time and can generate an alert for the nurse that says, this patient's been in this state for 2 hours, it's time to help them turn around. Or falls out of a bed, very expensive and actually, unfortunately, very common. So if somebody is at risk of falling out because they're moving around, they're at the edge, we can generate an alert to the nurse that says, this patient's really close to the edge of the bed, you might take a look, whether it's that through a video feed or actually physically go to the room. Saves a lot of time again, and certainly very helpful for the patient. So bringing all that stuff together as a single connected device will really make a big difference here. While we focus a lot on the US market, healthcare is global. And so one of the big advantages we have with Oracle Cloud is that we are in so many regions. So one, that IoT platform I just talked about, like with everything OCI, everything everywhere, right? We're, I think, the only cloud vendor that commits to having every cloud service available in every region that we deploy in. Many of the competitors on the cloud side have some services available in some regions and not in others. And so it becomes very difficult for developers, for partners to build applications and services that work globally because a certain service might not be available. So in our case, like with everything, everything is everywhere. So the IoT platform is ubiquitous across all of Oracle Cloud, all the new regions coming up, and so forth. So the future, which is already partially here, is connect everything. In healthcare, more than any other industry, it's going to save lives. It's going to make the experience for the patient a lot better. It's going to create much better outcomes for everyone. And it's going to really save money for hospitals, clinics, and doctors' offices as well. And that is actually very, very important because a lot of hospitals are not in great financial state. Right? We have lots of issues in the healthcare sector in terms of that. And so automation here will hopefully make that a lot more efficient and give a lot better insights into everything that's being done at a hospital, both in terms of equipment, but also in terms of managing and handling patients. So that's a little bit of an overview of what we have been building, what we are building, and what, if you're interested in IoT yourself, I think this is a good use case of how we are using our own IoT platform for solving a problem. But everything I talked about, you can do in any other industry. If you're building a greenhouse and you're tracking the sensors in the greenhouse for temperature and light and whatnot, you can use the exact same platform, bring in the data, build your Apex app or your React app, whatever you want, on top of the database. Take your LLM, use the database as a RAG engine or have an MCP server in front of it. It's all exactly the same stuff, just a different use case. So with that, I hope you have another great day here at AI World, and thank you for coming.